Welcome to the office. Welcome back, sir. Good to
Thanks
have
for
you.
having me.
You're welcome. So we've been working on you almost a month and a half, right? Getting on 2 months now. You reached out to me
I did.
because of the back.
Yes. Knocked on your door, reached out.
He was stalking me.
I got a call saying, oh yeah, the next appointment is in 3 months. I was like, oh shit.
Yeah. So, and Sasha's, he's a dancer.
I try.
He dances a little bit, right?
I try.
Yeah, no, he's an amazing dancer, actually. But he reached out, and I know that if you would have went that route, I don't know what would have happened. Okay, and I talked to the staff, and we just tried to make it happen, and we made it happen.
For sure.
We figured out a few things. This was an L5 herniated disc, but it was a special case with you because it wasn't just to fix the L5. We had to start where? Down low. We were down in like S2, S3. Once we got that stabilized, then we were able to work on L5. And it was a little bit of a challenge to figure out his combo, but we figured it out. And it wasn't anything in the textbooks that I learned. It's just we had to figure it out with him each day. And each day was different.
Absolutely.
Yeah?
I mean, this is definitely a better route than, I was told surgery. I've got a season coming up, so my brain's just like...
Season for what?
Dancing with the Stars.
Dancing with the Stars. I like it. Nice.
So I need to be 100%. That's like my main goal. And this is the route. Let's do it.
And we're just going through a process. Now, from where we started, we've gone through a process. We did do a re-x-ray after a certain number of visits. We did see a little bit of heightening of the disc, so I'm happy with that. Now, I do want to talk about this. He's a high-level elite dancer. That's what you are.
That's what I am.
That's what he is. Whether he's going to
That's why I'm flexing right now.
Yeah, what's that? That's
Shut up, put my shirt back on.
But no, on a serious note, he's an elite dancer. And I've taken care of elite dancers and gymnasts and ballerinas and sports people. And what happens is we've come so far, but I know you feel every little part of the body. I know that. And we discussed this, that I told him, as I tell everybody, it takes 3 months to heal. Right? We talked about that.
Yeah.
And that 3 months of healing doesn't mean you're getting cracked 3 times a week. That wasn't what this was about. It's just letting those tissues heal. And I think about a couple weeks back, it's like we're jonesing to get some movement. So I'm like, cool, get your movement in. No problem. He doesn't have a lot of other stuff, at which I was very surprised, going on in the body. The main focus is this L5 disc. And that's what we're going to continue on. Anything you want to add? Anything you want to share?
I mean, yeah, no, seriously, it's also a mental thing in my head because I never get injured. I've never been injured, so this happened last season in the semifinals, and I thought it was something that's just going to go away, and then it just wouldn't go away. I was resting. This is the biggest rest time I've ever had. We had no tour due to the pandemic, thank God, so this has been like the perfect window, and I just kind of want to feel like I'm back on my feet. I feel like if I wasn't a dancer, this is totally fine.
Right.
But I have to completely push my body to the limits. I'm one of those dancers that loves to fly, jump, flip, this, that. So I think the more we, push through this, the better it is.
Okay, that's good. And we're getting there.
We're getting there.
Shall we start?
Let's do it.
Let's do it. So talk to me. What are you thinking? What's on
We
your...
have an awesome formula, which we go from here to there to that bad boy.
But let me explain that formula. What I'm doing for him, we're affecting the L5 disc. But on this side, I'm doing the rotated sacrum to affect the L5 disc. Then we're going on this side to do the L5 for the rotation. Then we're going on that knee chest table to bury it. However,
that's my biggest fear. I don't know why. I need to start to relax, and I just don't, my body doesn't relax. I feel like if I was in this position and I'm actually lying and I could just breathe without my knees going up, maybe that could be something.
Okay. So why don't we give
it? Could be, yeah.
Okay. So we'll give the high-low a shot today.
Mm-hmm.
Cool.
And if not, then we can bounce back.
Absolutely. Let's run the meter and let's see what we got. Patient is dictating the care now. You see that, guys?
I did dance a little bit today.
How was it? What were you dancing to?
Some Cuban music.
What's your favorite music? What do you love to just chill to or just let loose?
Chill?
Chill versus let loose.
I don't really listen to music just chilling. I like to listen to it to like be creative or dance, or it's funny, like as a dancer, when you have music, it's like, oh, what can I do this to that? Or how can I do that? It's not, oh, I need to relax.
So I got 10 points, C1. What's your favorite genre?
Cuban, Latin American.
Okay. You like the salsa and that cumbia, right?
Mm-hmm.
That cumbia. We got a little bit at T6 today. Yeah, you did push a little bit today.
That's the thing, I didn't.
No?
At my standards, I feel like I had to not walk it, but mark it.
Now, let's see what we got down low.
I am holding the core in.
Relax. Be comfy. Come on back here, please. Is this comfortable for you? Relaxed?
Mm-hmm.
Okay. Now, let's look at the meter and see what happens. When he's in this position, 2 points. 3 points. Sit up straight and engage the core. Same thing. 4 points. I think you may be right, dude, about the high-low.
The what?
I think you may be right about this.
This?
Because right now, when you're going in extension and engaging,
Mm-hmm.
it's a little tighter.
Right.
Okay, so we'll give it a shot there and see what happens. We'll do the sacrum on the side as
Sure.
before.
Mm-hmm.
From there, we'll go right side for the
Mhm.
L5, and then we'll go on the high-low. After that, we'll take care of the other stuff.
No problem.
You got it. So in all your dance career, no injuries, huh? That's impressive.
Never.
From dance.
From dance.
1, 2, 3, 4, 5. 6 more tender, 5 more tender. 6 or 7.
Let's say that one.
Yeah. T6, L5. And now let's check up top. Sit back for me, please. Seven, 6, 5, 4, 3, 2. Turn left, turn right. Head down, this is isolating the upper cervical. Turn left, turn right. A little bit tight. Look up, tight. Okay. All right. Walk it off for me, Sasha.
Let's get to business, huh?
Get to business. So we're doing the PR sacrum, and then we're doing the L5. PR sacrum has actually a slight inferiority on the left side, so we have to go right side up and do a counterclockwise torque. Got it. Let's do it.
Let's work some magic, huh?
Let's do it, though. What if I said no?
No magic?
No, what if I said no? That I couldn't see you.
I'll just keep knocking on the door.
Seriously, dude? What did wifey say?
Huh?
What did wifey say?
She's like, you heard from him yet? What's the story? What's the story?
And you found me or someone referred you?
So my dad said, you should check out this style. It's very unique.
Your dad?
My dad in Australia.
Okay.
He said, you should try this style. It's very unique, called Gonstead Chiropractic. Saved my life. So I looked up Gonstead, best in America, and look who came up.
Interesting. Wow. Thanks, Dad. Relax there. Rotated sacrum, PR. A little more. There you go. Nice.
There it is.
Let's go to the other side, please. Now we do an L5. Bottom leg straight, top leg bent, slide the bottom butt forward. Dogs are doing good.
Dogs are doing great.
Awesome. L5. Nice and easy there. Oi, gotcha. Woo. Nice. Walk that off, please.
That is beautiful.
At the end, you are going to have to do a little bit for us. You know that, right?
Just a little.
Just a little bit. Tease them for the new season. Okay, we're going to now go face down on the high-low. So now here's what's going to be interesting. He's Sasha, but I need my Sasha to come in now. Sasha! Hey, Sasha.
We're getting the team back together.
You're getting the whole team together.
Wow.
Sasha! Actually, it's Sasha, and Sasha. Slide up. Thank you. Down a tiny bit. Right there. Perfect.
Where am I putting my hands?
Okay. So ideal rest. Palms up. Receive. If you feel you're tensing up here in the muscles, you drop them down here. What are you most comfortable with is the question.
Here.
Perfect. Then you stay there. All right. Let me get on his 5 Sasha and I'll call you in just a second. Now, we're just getting more of that 5. Go ahead, Sasha, you can hold. And the key with this is, as I'm pushing down, I'm lifting that L5 with my pisiform. I'm doing this. And Sasha can tell you, I'm not just pushing down, right? I'm going down, I'm lifting. Do you feel that? I'm lifting the bone. And are you good here to relax? Good. Let's pump it a little more. There it is. Good. Got him, Sasha?
Yeah.
Nice. You got a little more.
Yeah.
You okay with that? That's it. Beautiful. Okay. Thanks, Sasha. Well, you definitely did relax better there.
For sure.
Yeah?
For sure.
So I think we're going to try this combo 1 or 2 times.
I mean, it's stinging a little.
Okay. How was it compared to the knee chest in terms?
I feel like this felt deeper. Like it's
Okay.
a little bit hot right now.
Okay. Walk it up. Walk it up. Walk it up. Walk it up. So tell me, how you got on Dancing with the Stars?
Fun fact.
Yeah.
I was performing at the Pantages.
Here?
Yeah.
Okay.
In a Broadway show called Burn the Floor. We were on a Burn the Floor Broadway run. Okay. And it's been a dream of mine to be on Dancing with the Stars. I did it in Australia. I did it in India.
They have Dancing with the Stars in India?
Yeah.
Oh, okay.
They have it everywhere, but it was just always a dream of mine to come to America, be on the American show, because the American show is literally like the biggest of the best in America. And
is it the toughest?
It's definitely the toughest.
Out of all the ones you...
Oh, yeah.
Okay.
But the producers came to watch, and then I got a call, and they said, listen, we want to have a meeting with you. Had a meeting, and then I was on the season.
Awesome, dude.
I mean, I grew up in Russia, moved from Russia to Australia. Never in a million years would I think that I would be like in LA on a dance show. So dreams do come true.
Yes, they do. And miracles do happen. Right? Yeah, come on. They do happen. Now, the other thing I do want to mention, as in the next few weeks, we did say, you got a couple more weeks before you're going to start practicing a little more intense, right? And when that happens, realize, because this is good information, that you haven't been injured before. So this is actually a good learning lesson for you in terms of how to rehabilitate yourself and get back into it, right? It's not just me giving you all these limitations, because I don't want to do that.
Right.
I don't generally like to do that with patients, but in your case, I really made a point to say, don't do this.
Right.
Only because it heals better, you dance better. But in the first few weeks of the intense training, you're going to feel stuff.
Right,
okay?
right.
And we'll get through it, okay, Sasha? We'll get through it.
Yeah, we will.
Yeah, we will. Now, let's see. Come back slowly towards me, L5. Curve the back and lean back nope. This is your fulcrum, my finger. Come back on my thumb. You're rounding your back. Keep extension, extend back. Extend back. Good. Extend back. Good. Extend back. So here's what you're doing, Sasha. Here's what I need you to do. Let me show you on the spine. So when we're doing these extensions, I want you to fulcrum an extension here. So I want you to go back like this. You're doing this. As you come back, you're rounding this part of your body.
Oh, okay.
So get that nice curve back in extension. Yes. Keep going. Keep going. Now, let's watch his back, please, over here. I want you to see this. You're going to come back slowly until pain resistance or your feet come off the ground. This is my spinal flossing exercise. Hands across your shoulders. You're going to start doing these. Good. Keep going. So I call it spinal flossing, just like we floss our teeth. We should do this now every day, okay? We haven't done these yet. You good? Keep going. You feel the difference in the extension this way? Because now I'm actually getting more movement in your L5. The other way you were doing it, Sasha, when you were coming back, you were rounding back here, so you were blocking L5 to not get that movement. This is also going to help you with what? Getting on that knee chest table if we need to. So this is actually a good example. I didn't see this before, by the way, that when he would go down in extension, he would seize up.
Yeah.
Like you would get tense.
Yeah.
But when I asked him to do a simple extension, you did the same thing as the knee chest. So now we're retraining. I want you to see this because this is completely different when he's like this. So that puffiness is almost gone when you have proper extension. Go back slowly again. Just watch. Go back up. Pain resistance or the feet come off the ground. Now engage the core, belly button in and up. Now go back in extension. Easier or harder?
Easier.
Then do it this way, please. And as he's doing it, I'm feeling good movement in the spinous. It's not sharp, is it, at the end? Good. 5 more. 4 more. 3 more. 2 more. Awesome. 1 more, please. Walk it out, sir. Now, I'm also going to send you this, Sasha, for you to do at home. I'll just send a little.
Yeah. And then, so what? Just sit on the table?
Sit on the edge of a table, bed, chair. As it gets easier, more advanced work on the gym ball.
Right.
Not yet, though.
Okay.
You can do the bouncing on the gym ball. You can start the spinal flossing and all your other stuff you're doing.
Okay.
Okay. Just loosen up a little bit. Now, this is the other thing that surprised me with Sasha. I've had a lot of athletes here. And one of the tests is to jump up on the table with the athletes. This was actually the most impressive in all the people I've seen. Jump up high, please. It's like a butterfly, dude. Drop down on your toes. Can you do that 2 more times, please? And then we'll check, make sure nothing went out in the back. Good. 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 Anything else you want to do? Any other movements?
Yeah, it's basically like...
You do a lot of that hip action, right?
We do a lot of like trying to use our back. Like if we're dancing, it's all about the back, and I feel like here at the moment
I'm watching it.
like I can't push this out how we usually would, if that makes sense.
Oh, hold on, dude.
Like,
so what he's telling me,
it's like it's...
Hold on. You never told me that either. This is good. Remember, I'm pushing the sacrum forward.
Mm-hmm.
It has to heal. You're pushing it back.
Back. Right.
Hold on. Come back over here. Let me check something. This is not Gonstead, and this is not traditional, and this is not in the textbook. But maybe I do have to do that left pelvis, okay?
Mm-hmm.
Scoot forward, please. Feet together. Open and close the knees. Open wide and close. Open, close. Open, close. Right side only. Left side only. Yeah. Let's bump that hip.
It won't bump the disc the other way?
No, I'm not touching the disc. Okay. And I'm going to do it in a way. Let's do it involved side down. Left side down.
Mm-hmm. Left side.
I get to grab your glute today. I'm going to grab your gluteus maximus, senor. I will take my watch out for you.
Now we're talking.
Here's what I'm doing, just so you know. Just so we don't disrupt anything. Typically, I would do it involved side up and push it this way.
Mm-hmm.
I don't want to take a chance of this twisting out.
Right.
We're doing it involved side down. I'm grabbing it like this and pushing it this way.
Gotcha.
Just like that. Okay. All right. It's going to be abduction of the femur, not a bicycle kick. All right. You tell me if anything feels off.
Mm-hmm.
Lift up. There we go. Okay. Right there. Okay. And it's going to be, you okay there?
Mm-hmm.
Just like that. A little more. Negatory. Face down over here, please. This is a 1970 model. The Zenith 210 high-low with all the Gonstead modifications.
Wow. How many miles on this bad boy?
It's got a lot of miles, dude.
Not bad.
Slide up a little more, please. So I'm pushing up with the left, so I need to stabilize down with the right. I'm not thrusting with this one. It's this one. Stabilize, stabilize. A little more. A little more. There you go. Now, go ahead and do those same hip back movements, please. Let's see. Just keep. Just keep going. I'm just watching. I haven't touched his mid back. It actually looks fine. His curve is good in his low back. There we go.
Might have to teach you how to do these figure eights.
I got no lower body skills, dude.
That's what all my celebs say.
Keep going. How is that feeling when you're doing this? Talk to me. Give me feedback.
I think it's a little spicy only because
Of what we did, right?
I played around with a little bit of like just movement before I came to you. Just a little bit.
I don't see anything restricted, by the way. What do you feel besides, not spicy, but what do you feel stuck?
Jarred.
Where?
Right there.
Okay, now let's do one more thing. We're going to
Sure.
do the buff and polish. And then you're going to do the same thing and see if there's difference. So we've already done the joint, we've done the disc and the nerve. Now we're doing the fascia and the muscle. Round, extend. 2 more, round, extend. 1 more, round, extend. Go ahead and try that again, please. I just don't want to overstimulate that. I want it to heal. I would rather you do what you're doing right now. Okay? And even if you don't go hard, just get your natural movements and your dance movements. Get your body mechanics down. And you're still visualizing, right, every day?
Meaning?
As a dancer. You see, you do a lot of visual routines, right?
Yeah.
Because that's just as important.
For sure.
Yeah? Just keep going. Is it different from the machine on the soft tissue, on the muscle?
That one?
No. What I just did this machine, did it change anything? And if it didn't, it didn't. But
it definitely did. It definitely did.
Okay.
It feels like, you know, when there's like a block, it feels like, not that it's my hip, but when something's like this and it's just stuck and you need to like put air in it, so oil in it. I don't know, like.
Okay. It feels jarred.
That's the word I'm looking for.
Okay. Turn around. Let's see the movement again, please. Oh yeah. Oh yeah. Here we go. Here we go. Here we go. There we go. Good. Have a seat. Let's re-sculpt. Make sure everything is clear. And
Should I ice after this?
Always.
Gotcha.
Always. Even after any practice.
Oh yeah, no, I did dance today, but I didn't want to ice before coming because you said not to ice before coming. It's hard to read.
Correct. I'm going to do one more thing and then have you do that move one more time, okay? I still have that. That's clear. So let's do the neck and then let's have you, because we know the upper cervical can also cause tension in the cord and can affect the low back as well. Sit back for me, please. All the way back.
Like a recliner.
There you go. Left ear down. Whew. Gotcha. Baby, do your same moves again, sir.
Yeah.
Yeah. All right.
Brilliant.
We got our process. I appreciate you.
Thank you for having me.
You're welcome, and we're going to see you in a few days.
Sounds good.
All right.
Let's do it.
Take care.
Thank you.